Hello everybody, welcome to another presentation of our life-changing work here at London Dental Specialists. If you like our videos, please subscribe to our YouTube channel and also follow us at London Dental Specialists on Instagram and Facebook. So let's get into today's presentation. It is about this 63-year-old lady who in general just did not like her smile and her ability to eat properly. So let's see exactly what the issues were. This is a picture of her smile, and you can see immediately that her upper and the lower front teeth don't meet properly. The one thing that you cannot see is that most of her upper teeth on the front, right, and the left are all missing. And the only natural tooth in the upper jaw was this one. And in the lower jaw, all the back teeth were also missing. And the only natural teeth were these ones. So from there here to there. Okay? It's therefore not so surprising that she was dissatisfied with the outcome. So let's look at exactly what we did. We took her from here and gave her a set of teeth that met both in the front and in the back, both on the right and the left. So some of you will be thinking, how on earth did he possibly do that? I've skipped an important bit in the presentation, and I've done that on purpose because I would like you all to know that the aesthetics or the appearance that you can see here and the functional outcome, okay, are the same. So you will always get teeth that look like this and bite like this in all the options. Okay, because I'm sure you would have all figured out from my previous videos that there are multiple options for these kinds of cases. So if we're able to guarantee this appearance, the only difference therefore between the options are the mechanics behind them, what the things that actually make teeth like that. Therefore, to find out what is right for you, I tend to ask a series of questions, and they are like this. Do you want fixed or do you want removable teeth? Okay? Because if you fixate, if you don't bother on each other, then all the options are available to you. But if the thought of being able to take your own teeth out fills you with dread, then clearly it has to be the fixed. Next question is, how do you feel about your palate being covered? In this situation, this lady had been wearing dentures for 30 years and wasn't particularly concerned about continuing to wear something that covered her palate. I must say that you might be thinking to yourself, why is that question in there? It is because some patients, in fact, many patients report the fact that food tastes different and their experience of food is different when they have their palate covered. And so for some people, that's a problem. For some other people, it isn't. And the most important question is, what is your budget? Now, we're asking the budget because, as I've said, all the options that I will use will lead to that. Okay, it will lead to an outcome that looks like that. You'll be able to smile and eat with confidence. So they all ultimately look the same. And in much as a Fiat Punto or a Mercedes-Benz will get you from A to B, they both do ultimately the same thing. The differences between both cars feel different about our feelings. Is exactly the same thing here. The difference between a denture, an old school type denture, or a modern day denture, or some fixed teeth, they're all, to be honest with you, they're all like cars. They'll get you from A to B. It all depends on how you feel about having your own teeth. So let's actually look at what we did for this patient. And to start with, let's look at her answers first. Fixed or removable, as I said, she wasn't that bothered. Palatal coverage, again, not bothered at all. And her budget, she says, absolute maximum OP was £15,000. And that is what we created. Look at that beautiful smile set within a very beautiful face. What did we do? We placed 3 implants in the lower jaw as normal and 4 implants in the upper jaw. And this is actually what the 4 implants in the upper jaw is what actually made this treatment take 12 months. For those of you who have seen previous videos where I did similar treatments, and I didn't have to place implants in the upper jaw, but in this lady, the anatomy of her upper jaw meant that a denture wasn't going to sit there with suction, and that's why we had to do 4 implants in the upper jaw, and they therefore took 12 months to complete. As with every dental implant treatment in London Dental Specialists, there's a 10-year warranty, and the patient was so ecstatic, she gave us a video testimonial which you could have a look at, and that's why I'm using a full face picture here. So, ladies and gentlemen, please don't suffer in silence. You saw where this lady started from. She found us on Google and gave us a call. So why not follow her example, pick up the phone, and my team and I are only too willing and able to work with you to give you the smile of your dreams. Many thanks.